Hello everyone, Dr. Carlo Oyer, emergency physician with DrER.tv. In this video, we're going to talk about all kinds of stuff related to local infiltration. Why? Because lately I've had many questions about the local infiltration of lidocaine. When to use epinephrine, what is buffering and does it help? How much volume is toxic and what are the symptoms of toxicity? And other similar questions, and that made me realize I could use a refresher on this information myself. So I went to study, I made this video review on the subject, and we will start from the very basic and go to the very advanced concepts. I hope you enjoy this video and learn a lot from it. Please watch it all the way to the end. Let's talk about infiltration anesthesia. What is it? It involves the injection of anesthetic agent directly into the tissue prior to surgical manipulation. A field block involves the subcutaneous or sub-Q injection of an agent in such a manner to create a field of anesthesia around the site where you're going to operate or do your procedure. Indications and contraindications of infiltration of anesthetic. It can be used for the majority of minor surgical procedures such as the excision of skin lesions, incision of abscesses, and suturing of wounds. An advantage of this over a nerve block and general anesthesia is that it's considered both quicker and safer. Local infiltration can also help with hemostasis, which is bleeding control, both because it directly distends the tissue and because one can use epinephrine when doing the injection. A major disadvantage of local infiltration, at least when compared to a nerve block, is that relatively large dose of the drug is needed to anesthetize a relatively small area. For large wounds, the amount of anesthetic required may risk systemic toxicity, which we will talk about. The maximum allowed volume can be increased by adding epinephrine during the infiltration or using a lower concentration of the anesthetic. Another thing to consider is that local infiltration also distorts the tissue that will be incised or repaired and may be undesirable in areas requiring very precise alignment like cosmetic repair of the face or the lip. Choosing the anesthetic agent. Some of the more common local anesthetics are lidocaine, bupivacaine, and Procaine. Lidocaine is by far the most commonly used because of its excellent activity profile, low allergenicity and toxicity, user familiarity, and ready availability in the emergency department and other places. Procaine is useful for patients who are allergic to amide anesthetics. It's a good agent of choice if they're allergic to lidocaine. Because of its prolonged duration of action, bupivacaine is considered by some physicians to be the preferred anesthetic, especially when post-operative analgesia is desired for prolonged procedures or short procedures in the ER that may be interrupted because you're so busy and getting phone calls and such. Lidocaine generally lasts for about an hour, while bupivacaine can last up to 6 hours. So, if bupivacaine can last 6 hours or 6 times longer, then why not use it all the time? Well, there is potential for injury if the patient cannot feel that part of the body after they leave the emergency department. Also, having a numb area is also very annoying and can cause the patient to play around with that area, therefore damaging the tissue. In addition, the pain of administration of bupivacaine is more than that of lidocaine, and the chances for cardiotoxic and CNS central nervous system side effects is more with bupivacaine. How can you increase the anesthesia time of duration? You can add epinephrine and or bicarbonate to the lidocaine. By adding epinephrine, you can also decrease the peak blood level absorption of that medication, therefore decreasing the chances of a toxic reaction, and allows a greater volume to be injected in larger lacerations. However, adding epinephrine also lowers the pH or the acidity, makes it more acid, therefore increasing the pain associated with the local injection. How much volume can be injected safely? For lidocaine, it is 300 milligrams in an adult. That is 60 milliliters of the 0.5% concentration, 30 mL of the 1% and 15% of the 2% concentration. For bupivacaine, 0.25%, it is 175 milligrams, which comes out to about 70 milliliters of local injection. If you add epinephrine, you can pretty much add 50% to the total volume of the injection without getting toxic. How long does different local anesthetics take to numb? They're all about the same onset of action, about 2 to 5 minutes. Complications of local anesthetics. Wound healing. Local anesthetics can produce cytotoxic effects on cell structure and function in a dose and time-related manner. Collagen synthesis, for example, is inhibited. At higher concentrations of the anesthetic, the tensile strength of the wound is progressively reduced. Adding epinephrine can cause further decrease in its tensile strength. Conclusion: if tensile strength is important, like on a joint, do not use epinephrine. If the patient has poor healing wounds or history of the same, then avoid local anesthetic altogether. Wound infection. It has long been known that local anesthetics possess antimicrobial activity, at least in vitro. So there is a theoretical advantage to using numbing medicine as related to infection-related wounds. Now let's talk about the systemic toxic reaction. These only occur in 0.1 to 0.4% of local anesthetic administrations. When you inject locally, some of the medications enters the systemic circulation. Peak blood flow levels are produced within 30 minutes of that injection. High blood levels. Several factors will affect how high a level the drug reaches in the bloodstream. The site and the mode of the administration. The more vascular the site is, the more systemic the absorption. For example, an intranasal injection or even local would produce higher levels than intradermal injection in an arm or leg or so on. Therefore, the same dose of lidocaine given in the abdominal wall subcutaneously will be fine, but when used in intercostal nerve blood might result in toxic blood levels. The rate. More rapid IV injection will produce higher levels than the slower injections. Also, dose and concentration. This is just self-explanatory. The more of the drug you give, the more potential for toxicity. And of course, inadvertent intravascular injection will increase the blood levels of that medication. Recognizing central nervous system toxicity. Symptoms include drowsiness, numbness of the tongue, lightheadedness, tinnitus, which is ringing of the ear, visual disturbances, muscle twitchings, convulsions, coma, and even apnea, meaning you stop breathing altogether. Tetracaine can produce apnea or cardiovascular toxicity without causing the CNS manifestation. So, in other words, it's a little bit more dangerous because you don't get no warning about it. Recognizing cardiovascular toxicity of these agents. Moderate blood levels of lidocaine can cause an increase in cardiac output, heart rate, and arterial blood pressure. At higher doses, it can cause myocardial depression, manifested as hypotension and bradycardia, slow heart rate, which can lead to a total cardiovascular collapse. So, what did you learn in this video? You learned about the 3 more common local anesthetic agents, when to use epinephrine, when not to use it, what is the maximum dose of the medication you can use, and what are the signs and symptoms of toxicity if too much of that drug gets into the bloodstream. I hope you learned a lot during this video because I certainly did, making it for you. Please comment below, share and like, and let me know what you want to see in our next educational video. For now, bye-bye.